Good morning, and welcome to a special edition of United Way Facebook Live. This week, we are going to be talking to Ms. Humbert from Mobile Community Action about Head Start and Early Head Start. Welcome,
Good
and thank you
morning.
for joining us today.
You are welcome. Thank you for having us.
We are very happy to have you. Tell us a little bit about Head Start and Early Head Start.
Okay, so Head Start overall is a federally funded program. We're funded out of the Office of Head Start, and we service low income families for school readiness services, comprehensive school readiness services, meaning that we service families who fall at or below, for the most part, the federal poverty guideline, to help prepare those families and those children for their matriculation into public school. So early Head Start, we've had a couple of years now, and it starts with children ages 6 weeks old. So from the time the child turns 6 weeks, up until the age of, we stop taking applications to begin to transition those children at the age of 2.5 to 3, so that they can then just go into our Head Start program, which starts at 3 years old. But both programs are specifically designed to work with children through play. We use the creative curriculum, as well as some other additional curriculums that we add on, to the side to, help enhance our children's, abilities, to learn, because that age group, from the time that they're babies till they're 4 or 5 years old is when they're like sponges. They soak up, all of this information and all of this knowledge. So we think it's very important that they are prepared, with being taught different socialization skills, of course, their ABCs and 1, 2, 3s when it gets to that age appropriateness in the program. But that's basically what early Head Start is, from the babies to 2.5 or 3. And then Head Start takes over from 3 to 4 or 5 whenever they turn 5 years old and able to go to kindergarten.
Okay. Well, and correct me if I'm wrong, but there's also some family support that comes with it.
There's definitely.
Okay, tell us about that as well.
And that's what my role is. I'm basically, I hold, there's two different, areas as far as what I do. There's the family engagement side, which is that family support side, which we have family advocates that work within our program to not only take care of the other side, which is the enrollment, recruitment, and selection of all of our children and things like that. That's the URSA side, where how we get our children in the program. But once they're in the program, there is that family support side, where we work with parents while their children are in our program to help them develop, do family development plans, family partnership with that family, to help them, reach the community resources that they may need in their community in order to help that family get a head start. A mom might want to, continue her education. A dad might be looking for a job. If it's a grandparent looking for support, in helping to raise the grandchildren. So it's our job on that family services or family engagement side to connect the family with resources that United Way may offer, as far as the community agencies, and how we can assist our families in meeting the needs of their family while their child is also enrolled in our program.
That's wonderful. So how does one enroll their child? Are there there's an application?
Okay.
Is there
Right. There is
qualifications?
an
And
application
okay,
process. There is an application process. It's because people think, okay, I registered, so my child is going to be attending. For the most part, we want to accept as many family because we're funded for a certain amount of children to enroll in the program. So our maximum is that amount, but we have to maintain a wait list because they want us to make sure that we are able to fill all of our slots as soon as we can if one becomes vacant. But the process has changed a little bit, of course, due to COVID or whatever. It used to be that you can only come into the center to complete an application or pick up an application, but we are offering our application process is they can do it one of three ways. They can right now our centers are back open except for our sites that we do have some sites in the schools that are, since the school's not open, they can't go there, but we have where they can pick up an application at the center, and the advocates there will walk them through the process of what they need to do. They can download an application from our website, which is mcamobile.org, or on that same website they can start the application process by completing an online application, and then they'll be sent an email letting them know what documentation they need to bring in to complete that process, because we can't what that initial online application does is just puts their information into our data system, but we're not able to process anything until they bring in their documentation. So it's like it's just their information sitting there until they bring in their documentation to whichever center. They can only apply at one center that they want to attend, but then they can always transfer from one center to another center without having to redo an application.
Okay. And I just put that in the chat. So get an application at one of Mobile Community Action Centers. They can download an application, or they can complete the form online and then finish registration with you guys on site.
Right, exactly.
Okay.
So those are the three ways that they can do it. And parents, and we do some parents that like I said, we work with low income families. That's the purpose of our whole program. We want to make sure that all of our eligible families are served, have that priority to be served first. But we do have a percentage of over income families that we can accept depending upon what their their situation is. We work with children with disabilities, and for us sometimes that's different than what just a disability is. For us, a disability is anything that that did that takes away from or hinders that child's learning process in the classroom. So that is determined by, we work very closely with our public school systems, especially Mobile County Public Schools, and they do all of our uh, testing as far as what qualifies, the child to get disability services, which most of the time is like speech and language, issues, because the child, developmental, some developmental issues as well. So we work very closely with the public school system to make sure those services are offered, and they come into our sites to offer those services to children that need them.
Wonderful. So really it's the main eligibility requirement is income, but there's some wiggle room in that. Are there any other eligibility issues
Well,
or concerns or things that
other
people need to
thing,
be aware of?
right, the only other thing, our program is basically based on age and income. As long as
Okay.
they meet the age criteria and they meet the income criteria, then those are the two things that our program is based on. Now, there are some requirements because they participate in the program, that there are requirements that we're required to make sure that they have, as far as we're required to make sure that they have an annual well child exam, which is just a physical. So, and we know that, Medicaid, which most of our parents are on, restricts the number of times they can go to the doctor and, things like that. But if they've had it, we just need to make sure it's up to date, as they, go through the program. And that's once a year. The other thing that's required as far as participation in the program is for us to make sure that they have a completed dental work established and done, and that's every 6 months. So if they start our program and they get a dental form completed, then it may be before the program ends that we remind them, hey, every 6 months Medicaid requires, or that's a requirement for them to go back to the dentist and make sure that their child is teeth are healthy and things like that, because we recognize and we realize that um, sometimes those are things that keep our children, if they're ill or sick or have something going on, with them, then that hinders their learning process, how they can focus, how they can concentrate, what, is going on with them. So those are other two requirements. And, within our program, like I said, it's comprehensive in that we offer different services. That's part of the health thing, to keep our parents abreast as to reminding them of those health issues. But we also have a nutrition part of our program, where our children are served breakfast, lunch, and snack every day, that they're that they're here. We also have, like I said, our health portion, our nutrition portion, and of course, the learning in the classrooms, where, like I said, we use our creative curriculum for the learning and things like that in the classroom. The family engagement side of our program, where we try to engage the families to become involved in their child's education by volunteering in the classroom, reading, doing different things in the center, so that the family is involved in the child's education.
That's super important, is to have the stuff that's happening at school also repeated in the home, so that it reinforces each other. That's fantastic. Is
Exactly,
there?
and that's what we
I'm sorry. Go ahead.
I was saying that's exactly what from the moment we do orientation with our parents, we want them to know our motto is, you are your child's first teacher. And of course, when you enroll in our program, we want them to understand that this is a partnership. We want to partner with the families, with the parents, to make sure that their child is receiving, the basics, but also getting that head start in learning other things, social skills, and things like that, so that that it can be shared with the family, and the family is given tools to make sure that they can advocate for their families as they move along.
That's wonderful. So, is there an enrollment period? I know you say you guys keep a waiting list. Is there like a certain time of year that um, it's best to apply, or just whenever people know that they're getting close to having an age eligible child? What would you recommend?
Well, I recommend that they apply as early as possible. We do have to keep a wait list, but some parents don't even realize that their child, they wait until the child 4, because they're used to, like public school with the pre-K classroom, they start at 4, but we start at age 3. So we tell the parent, as soon as your child start on their 3rd birthday, we can't take an application before them, because our system, reads them as earlier than that, of course, their age early. So once their child turns 3, they can make an application. Now, it depends on if we currently have slots available at the time, what the need for each individual center is, because what the process is, our parents have to understand, like I said, it's not just a registration and you're in process. They apply. And of course, most of our parents that apply are eligible. So all of our children, though, have to go on a wait list in our system in order for us to make them to accept them. So parents have to understand that all of our children go on an app on a wait list for whatever. We have individual centers, so each center has their own wait list. Okay, they're not all tied together on one big wait list, and then we select the center. Each center has their own wait list. So the parents have to be specific as far as what center they want their child to attend, because we don't provide transportation. We're not like the public school either, where we're districted off and and they can only go here or there depending on where they live or anything like that. So because we don't provide transportation, we're not set apart like that. They can apply at whatever center. It might be a center that's closer to their job, so they can drop them off and pick them up during that time frame. You're right, on the way or afterwards or things like that. So those are things that parents need to know as well. Our school hours, operate for the most part. We try to follow along with the public school calendar, Mobile County public school calendar, as far as days off and things like that. But our hours of operation for school is 8 o'clock a.m. to 2 o'clock or 2:30, depending upon which program that they're in. 2:30 is the latest for our early Head Start, and for those classrooms that we do have some state funded OSR classrooms within our program as well.
And what is at OSR?
I'm sorry.
What is OSR for folks that don't know?
OSR is the pre-K classrooms that the state pays for, or pays part of the portion of those classrooms to operate. So those are the same as the all of our classrooms operate the same, but those classrooms are partly funded by the same monies that come from the state of Alabama for the pre-K classrooms within the school system.
Okay. Well, that is a lot. Do you have anything else that you want to cover about Head Start or early Head Start while we wind down?
You're breaking up a little bit, but I do know you asked me if there was anything else I wanted to cover.
Yes.
I do just want to encourage all of the parents who may be listening or hear this, that if your child is between the ages of 6 weeks old to 4 years old, that cutoff date, as far as if your child will be 4 or not be 5, we cannot service them if they're 5 by September 1st. Once they turn 5 by September 1st, they have to register for kindergarten. So that's why I said, depending upon if they turn 5 September 2nd, then they're good for us. But if they're 5 before September 1st, they have to register for kindergarten. So we are in our active recruiting stages right now and taking applications for all of those age ranges between 6 weeks old to 4 years old by September 1st, or what have you, or even after that. But we started age 3, like I said, for Head Start, and 6 weeks for early Head Start. So and most of our sites, all of our sites that we operate, except one now, which is our Jimmy Knight site in West Mobile area, offer at least one early Head Start classroom. So if they have multiple children, one that's a baby and one that's, infant, one that's, toddler, 3 or 4, then we may be able to service both of their children, in the same center for the most part.
Okay, great. I've got that in the chat as well. Well, thank you so much for joining us today. This has been some really great information and a very important resource for our community, because all of the studies do show that early education really makes a huge impact on future outcomes for kids in our community, and that helps the whole community be better when all of our kids are starting off on good footing. So thank you for joining us today. And for those folks who didn't catch all of the stuff in the chat, I'm going to put up a 211. Oh, that's not the right one. I'm going to put up the 211 number. You can call there, and they can also give you the information on how to get in touch with Mobile Community Action and their early Head Start and Head Start programs. All right. Thanks again, and have a wonderful rest of your day.
Bye. You too. Bye.